21 Amazing health benefits of turmeric and ginger together doctors never tell you. 1. Anti-inflammatory properties. Both turmeric and ginger possess potent anti-inflammatory properties. Turmeric contains curcumin, a compound known for its ability to reduce inflammation. Research has shown that curcumin can inhibit the activity of various inflammatory enzymes and cytokines, making it effective in treating conditions like arthritis and inflammatory bowel disease (IBD). A study published in the Journal of Medicinal Food found that combining curcumin with ginger can significantly reduce markers of inflammation in individuals with chronic inflammatory conditions. This synergistic effect enhances the anti-inflammatory benefits of each spice. 2. Enhanced digestive health. Ginger is renowned for its ability to alleviate digestive issues, including nausea, bloating, and indigestion. It promotes the production of digestive enzymes, which can help in breaking down food more efficiently. Turmeric also supports digestive health by stimulating bile production, essential for fat digestion. Research published in the World Journal of Gastroenterology indicates that the combination of turmeric and ginger can improve overall digestive function and help alleviate symptoms of gastrointestinal disorders. Together, they work to soothe the digestive tract and promote regularity. 3. Boost immune system. Both spices have immune-boosting properties due to their high antioxidant content. Curcumin and gingerols found in ginger enhance the body's ability to fight off infections. A study in the American Journal of Physiology noted that curcumin modulates the immune response by increasing the activity of immune cells, thus promoting a stronger defense against pathogens. Combining turmeric and ginger can further enhance immune response. Their anti-inflammatory and antioxidant properties work in tandem to reduce the risk of infections and diseases. 4. Support heart health. Turmeric and ginger both contribute to heart health through various mechanisms. Curcumin has been shown to lower cholesterol levels, reduce blood pressure, and improve endothelial function, which is crucial for vascular health. Meanwhile, ginger has been found to reduce blood sugar levels and improve circulation. A meta-analysis published in Nutrition Journal found that ginger supplementation significantly lowered blood cholesterol levels and triglycerides, while curcumin has been shown to reduce arterial stiffness. Together, these spices may significantly lower the risk of cardiovascular diseases. 5. Anti-cancer properties. Emerging research suggests that both turmeric and ginger may have anti-cancer properties. Curcumin has been extensively studied for its potential to inhibit the growth of cancer cells and tumors. It does so by affecting multiple signaling pathways involved in cancer progression. Ginger, particularly its active compound gingerol, has also been linked to anti-cancer effects. A review in the Journal of Cancer Research and Clinical Oncology highlighted that ginger can induce apoptosis, program cell death in cancer cells, and inhibit tumor growth. When combined, turmeric and ginger may offer a powerful defense against various types of cancer, including breast, colorectal, and prostate cancers. 6. Pain relief. Both turmeric and ginger have analgesic properties that can help relieve pain. Curcumin can inhibit the production of inflammatory compounds, thus reducing pain associated with arthritis and other inflammatory conditions. Similarly, ginger has been shown to be effective in reducing muscle pain and soreness. A study published in the Journal of Pain Research found that a combination of ginger and curcumin was effective in reducing osteoarthritis pain, with participants reporting significant improvements in their symptoms. 7. Improved cognitive function. There is growing evidence that turmeric and ginger may help protect against cognitive decline. Curcumin has been shown to cross the blood-brain barrier and has neuroprotective effects. It reduces oxidative stress and inflammation in the brain, potentially lowering the risk of Alzheimer's disease. Research in the Journal of Alzheimer's Disease indicated that curcumin might help improve cognitive function in older adults. Ginger, too, has been associated with improved cognitive performance, particularly in aging populations. Combining these spices may support overall brain health and cognitive function. 8. Weight management. Turmeric and ginger may aid in weight management and obesity prevention. Curcumin has been found to enhance fat metabolism and reduce fat accumulation in the body. Ginger, on the other hand, has been shown to increase feelings of fullness and reduce hunger. A study published in the Journal of the Academy of Nutrition and Dietetics demonstrated that participants who consumed ginger experienced a reduction in body weight and waist circumference. Together, turmeric and ginger can be a beneficial addition to weight loss strategies. 9. Antioxidant benefits. Both turmeric and ginger are rich in antioxidants, which help combat oxidative stress in the body. Curcumin is known to enhance the activity of the body's own antioxidant enzymes, while gingerols provide strong antioxidant protection. A review in the Journal of Nutritional Biochemistry emphasized that the antioxidant properties of both spices can help reduce the risk of chronic diseases linked to oxidative stress, including diabetes and heart disease. 10. Support joint health. The anti-inflammatory properties of turmeric and ginger make them particularly beneficial for joint health. Curcumin can help reduce the symptoms of arthritis, such as joint pain and swelling, while ginger has been shown to alleviate stiffness and improve mobility. Research published in BMC Complementary Medicine and Therapies found that participants with osteoarthritis reported significant relief when taking a combination of ginger and turmeric extracts. 11. Regulate blood sugar levels. Both turmeric and ginger may help regulate blood sugar levels, making them beneficial for those with diabetes. Curcumin has been shown to improve insulin sensitivity and reduce blood glucose levels. Ginger, too, has been found to lower fasting blood sugar and HbA1c levels. A systematic review in Diabetes Research and Clinical Practice concluded that ginger supplementation could significantly lower blood sugar levels in individuals with type 2 diabetes. The combination of these spices can enhance blood sugar regulation and reduce the risk of diabetes complications. 12. Promote healthy skin. Turmeric and ginger can benefit skin health due to their anti-inflammatory and antioxidant properties. Curcumin has been shown to improve skin conditions such as acne, eczema, and psoriasis by reducing inflammation and inhibiting the growth of bacteria. Ginger also has skin protective effects, including enhancing circulation and promoting a healthy glow. A study in the Journal of Cosmetic Dermatology highlighted that topical application of turmeric and ginger extracts improved skin hydration and elasticity. 13. Fight respiratory issues. Ginger and turmeric have been traditionally used to alleviate respiratory issues. Ginger can help reduce mucus production and relieve cough, while curcumin has been shown to reduce airway inflammation. A study in the American Journal of Respiratory Cell and Molecular Biology found that curcumin can improve lung function and reduce symptoms of asthma. The combination of these spices may provide significant relief for respiratory conditions such as asthma and bronchitis. 14. Support liver function. Turmeric and ginger can support liver health by enhancing detoxification processes and protecting against liver damage. Curcumin has been shown to promote liver cell regeneration and improve liver function. Research published in Hepatology indicated that curcumin could reduce the risk of liver disease by protecting against fatty liver and fibrosis. Ginger, too, has hepatoprotective effects, making the combination beneficial for overall liver health. 15. Enhance mood and reduces stress. Both turmeric and ginger may have positive effects on mood and stress levels. Curcumin has been shown to increase levels of brain-derived neurotrophic factor, BDNF, a protein associated with improved mood and cognitive function. A study in the Journal of Clinical Psychiatry found that curcumin supplementation could reduce symptoms of depression. Ginger's ability to reduce inflammation can also play a role in enhancing mood and reducing anxiety. 16. Improve oral health. Turmeric and ginger possess antimicrobial properties that can benefit oral health. Curcumin has been found to inhibit the growth of harmful bacteria associated with gum disease, while ginger can help reduce inflammation and pain in the gums. A study published in the Journal of Periodontology indicated that curcumin mouthwash was effective in reducing plaque and gingivitis. Together, these spices can promote better oral hygiene and overall dental health. 17. Enhance athletic performance. Athletes may benefit from the anti-inflammatory and pain-relieving properties of turmeric and ginger. Curcumin can help reduce muscle soreness and enhance recovery post-exercise, while ginger has been shown to improve exercise performance and endurance. Research in the Journal of the International Society of Sports Nutrition indicated that a combination of turmeric and ginger supplementation improved recovery times and reduced muscle soreness in athletes. 18. Improve hormonal balance. Turmeric and ginger can help support hormonal balance in both men and women. Curcumin has been shown to regulate estrogen levels, while ginger may improve menstrual pain and symptoms of premenstrual syndrome, PMS. A study in the Journal of Alternative and Complementary Medicine found that ginger supplementation reduced menstrual pain in women, making it a valuable ally during the menstrual cycle. 19. May help with nausea and motion sickness. Ginger has long been used to alleviate nausea and motion sickness, making it a popular choice for pregnant women and travelers. Curcumin may also contribute to reducing nausea through its anti-inflammatory effects. A meta-analysis published in BMC Complementary Medicine and Therapies confirmed that ginger is effective in reducing nausea associated with pregnancy and chemotherapy. Combining ginger and turmeric may provide a powerful remedy for nausea. 20. Reduce risk of neurodegenerative diseases. Turmeric and ginger are both known for their neuroprotective benefits, which can help reduce the risk of neurodegenerative diseases such as Alzheimer's and Parkinson's. Curcumin, the active compound in turmeric, has shown promise in reducing amyloid plaques, one of the hallmarks of Alzheimer's disease, by crossing the blood-brain barrier and exerting anti-inflammatory and antioxidant effects. A study published in the Annals of Indian Academy of Neurology suggested that curcumin's antioxidant properties may help delay or prevent the progression of neurodegenerative diseases. Ginger's bioactive compounds such as gingerol have also been shown to protect brain cells from inflammation. 21. Support healthy blood circulation. Ginger and turmeric both support healthy blood circulation. Ginger has been shown to improve blood flow and reduce blood clotting by inhibiting thromboxane, a molecule involved in blood platelet aggregation. Meanwhile, turmeric helps enhance blood circulation by reducing oxidative stress and inflammation in the arteries, keeping blood vessels flexible. A study in the Journal of Nutritional Biochemistry found that ginger can improve blood flow and reduce risks associated with poor circulation, such as varicose veins and blood clots. Curcumin, on the other hand, has been shown to improve endothelial function, the lining of blood vessels, which can reduce the risk of blood vessel damage and improve overall circulation.